My name is Kyle Fulford. I'm a student physical therapist at the University of Central Florida, and today we'll be doing an assessment of the foot. So first, I'm going to start out. I'm going to have ask my patient to lie on their back. If you could please lie on your back. The thing we're going to assess is the passive range of motion of the interphalangeal joint of the big toe. So in order to do that, I'm going to take a small goniometer. I'm going to line it up along the first metatarsal. The axis is going to be placed above the interphalangeal joint of the big toe, and the movable arm is going to be placed on the distal phalanx. I'm going to stabilize here at the proximal phalanx and passively move his toe into flexion. I'm getting a reading of approximately 60 degrees of IP flexion, which is the normal value for this is 90 degrees, so he has some lack of movement in that toe, 30 degrees to be specific. The next value we're going to measure is extension at the interphalangeal joint of the big toe. So I'm going to take my goniometer, put it on the underside of the big toe, line it up with the first metatarsal. The axis is going to be right below the IP joint, and the movable arm is going to line up with the big toe. I'm going to stabilize here at the proximal phalanx, have this lined up here with the underside of the big toe, and we get 0 degrees of extension. Normal value is 0 degrees, so he has normal extension in the IP joint of the big toe. Next item we're going to assess are manual muscle tests of some of the toes. So first, for positioning, I want to be right here, good height to the table, good height to the leg. The first thing we're going to do is test the extensor hallucis longus and brevis. So I'm going to move the patient's big toe into the test position, hold that position. Now, because they can hold the position, I would automatically give them a grade of a 3. Now, to test it, I'm going to stabilize at the first metatarsal, use my 2 fingers to apply pressure into flexion. Don't let me move you. 1, 2, 3, 4, 5. I applied moderate pressure and didn't move him, so I would give the patient a grade of a 4. The next muscle we're going to test is the extensor digitorum. The first thing I'm going to do is ask the patient, can you please bring your toes up towards your body? He can hold that position against gravity, so I would automatically give him a 3 out of 5. Now I'm going to stabilize at the metatarsals and apply pressure at the proximal and distal intermediate and distal phalanx into flexion. Don't let me move you. 1, 2, 3, 4, 5. I moved him with slight to moderate pressure, so I would give him a grade of 4- out of 5. Now we're going to look at overall foot posture. The first thing we're going to look at is the calcaneal tendons. If you notice, they run straight down. There is almost no angle in between them. So that's indicative of a fairly neutral calcaneus. The next thing we're going to look at are the arches. His arches are fairly normal, so his foot is in a fairly neutral position with no noticeable eversion or inversion. And the last thing we'll look at is the amount of outtoeing present. Looking at him from behind, you should be able to see 2 to 3 toes on the outside of the foot. On his left side, I see 2.5 toes, which is fairly normal. On the right side, I see 4.5 toes. So on his right side, that would be indicative of outtoeing, which could be due to a number of different things. Typically, you'll find outtoeing in someone who has flat feet. Because of the dropped arches on the medial side of the foot, you'll tend to see more toes on the outside as compared to normal. But with this patient, they have normal arches, so the outtoeing could be caused by something like tibial torsion.